Welcome to Pennsylvania Newsmakers, and as always, thanks for watching. Well, the big issues facing the business community with a new governor about to take office, plus healthcare and you in 2015. We'll be back in a moment.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Well, here we are in January, heading to February of 2015. The Governor-elect Tom Wolf takes office this Tuesday. Joining me is the guy we call in to talk about healthcare, one of our healthcare experts, Dr. Stuart Shapiro. He's CEO of the Pennsylvania Healthcare Association. He's on Governor Wolf's transition team. But you were also on Governor Corbett's transition team, right?
I'm honored to have been on both, and it was a challenging time when Governor Corbett came in, and he faced budget deficits, and now Governor Wolf is also coming in, and the healthcare system is, as you know, in Pennsylvania among the best in the world. But there are budgetary challenges, and it's been a pleasure to work with on the transition team.
Yeah, well, I mean, these are important. We're getting cabinet officers named, even as we speak.
For sure.
They'll probably get a bunch more and getting all the boards and appointments and commissions. But look, Doctor, let's start with this. One of the big issues, senior population. I think now we have the fourth oldest senior population. It used to, or maybe three. We used to be two. I think we're now behind West Virginia and Maine. Is that right? Are we three?
Pennsylvania is second or third, depending on how you count. But the problems facing the elderly for health care are really serious.
Yeah. But that's my point. We got a lot of seniors now, right?
Yes, we do.
Go ahead. Take it
and a lot
from
of
there.
frail seniors. Yeah. And a lot of seniors who need care, especially when they're in nursing homes. And it's real interesting. When Governor Corbett came in 4 years ago, there was a budget crisis. We were in a terrible recession. Governor Corbett made health care a priority for the elderly, and he made the elderly and disabled a priority. And as you look at the services for the elderly and for the disabled, the quality has increased, despite the fact that there wasn't a lot of money, but Governor Corbett made it a priority financially, and there were no cuts for services for the elderly in nursing homes. And the quality went up. Now Governor Wolf comes in, and he's facing a $2 billion
structural
deficit, serious deficit. And during his campaign, he said health care for all Pennsylvanians is a priority, and he included the elderly and the disabled in that. So we're just hopeful, as people who advocate for Pennsylvania seniors, and especially those seniors who are getting care in nursing homes, whether it's on an acute care basis or on a longer-term basis, that he doesn't cut, or the administration doesn't cut any services. But everything that Governor Wolf has said is he is committed to the elderly, and he's committed to the disabled. And we're looking forward to, as advocates for the elderly, working with him to make sure that there are no cuts going forward.
In all the years that you've been on this program and we've done these interviews, I don't think I've ever asked you what seems to me is a simple, logical question. How many seniors are in facilities, nursing homes, and getting out of our population of a little more than 12 million?
On any given day, there's about 90,000 people, between 80 and 90,000 people in Pennsylvania's nursing homes. And if you look at then the personal care homes and assisted living facilities, there's another 50,000.
Right.
And in fact, of those 80,000 people in Pennsylvania nursing homes, about 50,000 of them, a little bit more than half, are paid for by the state and or the federal government. And that's
Medicare and Medicaid,
right. And that's why it's so critical that the state focus on this issue, because quality has improved dramatically in nursing homes. And it's only because there's been money being paid that's, while inadequate, and nursing homes lose money on Medicaid. Their costs are much higher to take care of those on Medicaid than they're actually paid. But they make a few extra dollars on Medicare from the federal government, so they're able to stay in business. And But unless those dollars from the state increase, the quality gains are not going to be maintained.
Right. Well, I want to go to a break. When we come back, I want to talk to you. Now, you just raised a great question. How are we going to pay for it? I mean, I think that's, as you know, a central question here. I want to get to that. But the point I would make going into this break is the requirement, the need to go to nursing homes, get extended and sort of this specialized care is only going to increase. People are living longer. The problem's only going to grow.
And the state has to figure out how to do it in the most efficient way.
Yeah. All right, I'm talking with Dr. Stuart Shapiro. We're in, I think, a critical question. I don't think, as we look around, who can sit out there and say they do not have someone in their family that has needed these services and have worried about how you're going to pay for it and what care they get? I'm going to continue my conversation with Dr. Shapiro after these words.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business. This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Highway Information Association, the go-to source to learn about transportation projects and issues. Please visit pahighwayinfo.org. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Welcome back to Pennsylvania Newsmakers, Healthcare and You in 2015. My guest, Dr. Stuart Shapiro. Okay, doctor, how are we going to pay for it? I mean, healthcare is not inexpensive, as everybody knows.
The state budget, as I said, pays for about half the people in nursing homes. And Governor Corbett has funded it, obviously with the legislature, to make sure that while it's inadequate reimbursement, at least the quality could be maintained. And in fact, 16 out of 18 measures have improved in Pennsylvania nursing homes. And in fact, there's been a 63% increase in the 5-star quality ratings, which are given by the federal government. But like any family knows, when you have to do things, you either have to increase your earnings, call that revenue for a nursing home, or cut expenses. And every family knows this. And one of the problems with the expenses in nursing homes is the crazy tort cost in this state. The out-of-state lawyers, and they're all from out of state. They come from Florida, they come from Alabama, they come from West Virginia, and they advertise full-page ads in Pennsylvania newspapers, inaccurate ads that have been shown to be deceptive and misleading. They play on people's fears. People then call them. They then sue nursing homes or hospitals. And the hospitals and the nursing homes don't have many protections. Doctors today have some protections against what's called punitive damages. And doctors fight 80% of the cases and settle a small percentage. Nursing homes, because there's no protections and because they're afraid of this tort environment in the big cities.
Most of them?
They settle 80% of the cases.
Settle
the exact opposite. Yeah. And the doctors used to settle their cases. Yeah. Now they fight them and they win them. And that's what has to happen in Pennsylvania if we're going to, again, reduce the cost. Because right now, about $2 of every day's pay to the nursing homes for the care goes right out their back pocket and into the lawyer's hands. And that's critical because those dollars ought to go to care.
Before I let you go, is there anything coming up, in the legislature or with the governor-elect in terms of health care that you're especially looking for? Are you looking for additional revenues? Governor Wolf-elect Wolf during the campaign was, certainly not talking about diminishing health care. There was none of that kind of I can't imagine the governor-elect, given during the course of the campaign, what he said, doing anything but continuing to fund nursing cares and the healthcare system in our state.
Governor Corbett's Governor Wolf is a very honorable man. And you have to believe what he said in his campaign, that health care for the elderly will be a priority. You have to believe that he's committed to quality care. You have to believe that he doesn't want to see nursing homes move backwards in the care they provide.
Right.
And you got to believe that he will support some tort reform to drive predatory lawyers out of Pennsylvania.
All right, thanks. You're going to come back, and we'll follow this through the course of this year. It's going to be a pretty fascinating year with a new governor-elect. Thanks, as always. Great update. All right, talking about Governor-elect Tom Wolf, business community, the reaction there, what's going to happen. We're going to have a couple of guests on to chat about that after we talk about money.
This broadcast of Pennsylvania Newsmakers is brought to you by Pennsylvania Credit Union Association. Pennsylvania Credit Unions, where people are worth more than money. To find a credit union that is right for you, check out ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is presented by the Hospital and Health System Association of Pennsylvania, working towards a healthy Pennsylvania, and by the Pennsylvania Coal Alliance, representing companies involved in America's most affordable, reliable energy source. To learn more, visit pacoalalliance.com.
Well, let's have a little business roundtable on Pennsylvania Newsmakers. Joining me, as often is the case, is Fred Anton. He's the CEO of the Pennsylvania Manufacturers Association, and Kevin Shivers, the Pennsylvania Executive State Director of the National Federation of Independent Business. You got a long title there, Kevin.
A lot of words, right?
A lot of words, yeah. But look, I'm going to start with you. Tom Wolf, businessman, very successful business guy, York County business, but my sense is there's an uncertainty in the business community. You can tell me, you can disagree with me. Am I right or wrong about what's going to happen?
The real question is, who is Tom Wolf, right? This was an election that really was a referendum on the personality of the former governor, Tom Corbett. And the question becomes, what is Tom Wolf going to bring as governor? Now, he certainly was a very successful businessman. And, you don't become that successful by alienating others, by only trusting yourself.
Yeah,
I mean,
right.
Good managers trust their people. They're consensus builders. They want to get a deal done. The question is, will Tom Wolf, as governor, bring those same talents and that acumen to the world of governing that he made so successful in the business world?
Yeah, I might point out as I go to Fred Anton that as this show airs around the state, Governor-elect Tom Wolf on Tuesday, January 20, will take the oath of office to become the 47th governor. I think I got that. Political historian, I better get that right. Fred's also a bit of an historian. All right, Fred, where does...
Well, of course, you recently profiled the first terms of various governors. This governor is somewhat unique in that he doesn't have a long political record. He sort of emerged out of nowhere. I think when he first emerged as a candidate, we would have said he was far behind
He was far behind in the polls. You're exactly right.
So the other professional politicians.
Yeah.
And he really has not had any period of public service other than 2 years as Rendell's revenue secretary. We don't know really how he's going to approach these difficult problems of governance. Mm-hmm. For example, with a governor like even Tom Corbett, we knew what he did as Attorney General. We had exposure to him. We don't really know. Now, we know he's a very caring, very liberal person. He wants to help the public. But I don't know whether that philosophy is necessarily going to help him with the problems of governance he's going to have.
Yeah. Well, let's go to one of them. I mean, one of the obvious things to talk about is the corporate tax structure in this state. There's been an effort through Governor Corbett's years to reduce, some of the business taxes. Correct? Where do you see all that going?
Well, the question is going to be, will Governor Wolf try to manage expectations with the constituencies that got him elected, right, Terry? Because the state that he inherited, and with the political climate that he now is facing in the legislature, we have historic Republican majorities in the House. There is a sizable Republican majority in the Senate.
30 to
so
20.
The issues that he campaigned on and was able to attract constituencies with, is he going to be able to get some of those agenda items through? Is he just going to, like President Obama in Washington, just pound those issues and play a very partisan game? Or is he going to try to find issues where he can manage in the middle?
Yeah.
The big challenge is this $2 billion deficit that he's inheriting. We have right now, gasoline, $2 a gallon. There's a flood of oil. There's $40 a barrel. You are not going to be able to generate $1 billion in taxes from the natural gas industry with a severance tax. Yeah. And if you have all of these other...
he's even admitted that they've reduced it. A 5% shale tax, would get about... Fred, let me turn to you. If you had to talk about one tax that the business community, and you and I have talked about this over the years, is concerned about, which tax would it be?
Well, it would be the capital stock and franchise tax. We've had a long period where we've successfully phased out the capital stock and franchise tax. We don't want to bring that back. That's been a historic tax in Pennsylvania, which has effectively been double taxed.
In 2 sentences, what's that tax do?
That tax is business
the assets?
The assets of businesses, yes.
So it's a general tax. It's a tax on the assets that businesses hold, correct? You guys are both. I know we use that expression. We want to make sure our viewers understand it. Go ahead.
And also, we don't want the corporate net income tax to go any higher. Of course, the corporate net income tax, I believe, is 9.9%. It's one of the highest in the nation. We don't want that to go higher. Now, even a increase in the PTI, the personal income tax, that would hit the S corporations. In other words, there are many businesses that are taxed through that personal tax rather than the corporate net income tax. So almost any taxes are going to be bad for businesses.
All right, we're going to continue our discussion on a couple other big issues that confront the business community that we want to talk with our 2 guests about. We'll do that in a moment.
This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Medical Society. Inspired physicians committed to the good health of Pennsylvanians and the advancement of the practice of medicine. And by the Pennsylvania Healthcare Association, the future of long-term care. This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Business Council and by the Pennsylvania Business Council Education Foundation.
All right, we're doing a little business roundtable here with Kevin Shivers and Fred Anton. They represent large sectors of the business community. All right, I was talking to Kevin. Let me start with you, Fred. Fred, we're chatting here about business regulations. It's something that I hear from the business community. State some of the concerns that the business community has. By the way, before I get to Fred, we're certainly going to have folks on from the Wolf administration. They're going to be invited. We've had people from the Ridge administrations, the Rendell and the Corbett administrations. The folks from the Wolf administration are welcome to come on this program anytime. Go ahead, Fred.
How business is regulated by the bureaucracy is always a big concern. Republican administrations usually take more of a cooperative attitude to remedy whatever difficulties businesses might have. Frequently, Democratic administrations are more stringent in their enforcement of the regulations. We found that certainly in the Rendell administration, particularly in the environmental area. Now, that is a big concern. And there are particular individuals who are in the Rendell administration who were very strident in their business regulation, and it makes a difference to business. It's a big issue to business.
Can most of these regulations, I mean, here we're, the president is doing, regulations on methane that are going to be obviously vigorously debated. We have the debate over the Keystone XL pipeline, the construction of it, but there are obviously environmental concerns with that, Kevin, as you know. Is your sense that most of it can be done, as Fred talks about, through regulation, or is going to need legislation to get it done, or a combination?
Well, that's going to be a big concern. What we've seen in Washington is that what the regulators could not get passed through Congress, they chose to use. The president used executive fiat, or the agencies just promulgated regulations to address them. 4,000 regulations were added to the pipeline in Washington last year. 1,000 of them impacted small business. The real question is, what is Governor Wolf going to do? Is he going to rely on those in the legislature to decide on these regulations, or is he going to empower his agencies and use his executive pen to impose all of these regulations?
Now, Fred, one of the things that you know, and you know well, you've known many of the past governors, you've met with them. As you point out, this governor does seem, as Kevin also has mentioned, point out that he's going to sit down, talk with people in the business community. He has that history over in York, where he worked with the business community there very closely on economic development. He was heavily involved in lots of local economic. Are you optimistic that you can develop a relationship with him?
No, I'm not optimistic.
Really?
I'm not optimistic for this reason. I think the pressures of the constituencies that elected him will be very powerful in his policies. I really do. I think that unions will have a greater influence than perhaps I think they should. Mm-hmm. I think that he will perhaps fund education beyond what the citizens are willing to pay for a tax burden. I think that his own personal views are not going to be the only thing that controls.
We got about a minute left, but the governor-elect has indicated his top priority, as Fred points out, is increasing education spending.
And the question is, how is he going to be able to do that with the revenues that are available? And certainly you're not going to be able to do that if you don't tackle the pension crisis in this state. That is the 800-pound gorilla facing this budget and many to come.
All right, well, we're going to have you guys back for these business updates through the year, as I indicated. We're certainly going to have folks on from the Wolf administration. They'll be invited. In addition, we had Senator Pat Toomey. We're working on the details to get Senator Casey on the program. The senator has been on before. We'll see you next week for another edition of Pennsylvania Newsmakers, and stay well.